Hello, everyone. Welcome to Lump Basics, episode 43. Let's welcome Sir Dino Pinero of Legazpi, Certified Associate Acupuncturist. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Okay, continue tayo po sa Lump Basics, Deep Energy Circulation. So, we have here point categories, yung cycle ng mother and son. So, yung black, yun yung yin organ, and yung red, yung yang organ. So, kung mapapansin po nyo, clockwise po ang rotation. For example, dito starts sa fire, papunta ng earth, metal, water, and wood. Sabay po yung yin and yang organs niya. The organs of the five elements have between them constant energy flows at the deeper level, called the mother and son cycle and controlling cycle. These two energy flows help maintain harmony between the organs. When they do not function properly, deficiencies or excess occur. These imbalances can be corrected by using the five element points in the meridian and sending energies from one to another. Eventually, to bring about a balance, let us consider these energy flows one by one. So, sa mother and son cycle, the organs of the five elements send energy to each other in a clockwise direction in the above cycle. Just like water nourishes the growth of trees, yung wood, and the wood is needed to make a fire, the organs of the water element nourishes what of the wood element. The kidney nourishes the liver, and the urinary bladder nourishes the gallbladder. There are two parallel circles, one between the yin organs and another between the yang organs. Perhaps it would have been better to call this father and son cycle and mother-daughter cycle. Unfortunately, in old China, as in the new, a male child was precious, but a girl would not carry the family name and was considered an it. So we refer the parent always as the mother and the child always as the son. How do we use the mother-son cycle? Let us suppose that in a patient lang yin was deficient and the patient had thin and dry skin, the dryness of the nose and throat. We should advise the patient to drink more water and humidify the rooms with houseplants and water containers on the radiators. In addition to this, we can also tonify lang yin with acupuncture. Sa tonification of mother-son cycle, in the mother-son cycle, there are two reasons why the spleen does not nourishes the lung. One reason is that the energy flow between the mother and son is blocked. This can be remedied by reinforcing the flow by giving the earth point of the lung 9. Lung 9 is called the mother point of the lung, as it receives the energy from the mother organ. By doing so, we have simply unblocked the energy flow between the lung and its mother, the spleen. So, we have here the tonification points ng yin organ, lung 9, heart 9, pericardium 9, spleen 2, liver 8, kidney 7. Sa yang organs naman, large intestine 11, SI 3, triple warmer 3, stomach 41, GB 43, and UB 67. Every organ has a mother point. It is the point that receives energy from the mother and is the best tonification point of that organ. When the mother point of a yin organ is used, energy flows in from yet another yin organ. All yin organs have more yin than yang energy in themselves. And so the energy that comes in will be more yin and little yang, like 90:10. But when a yang organ is tonified, the energy that comes in will be more yang and less yin, like 90:10. The mother point or tonification point will always work well, provided that the mother organ has enough energy. But in the case where the patient is thin or malnourished, this spleen is also weak. It is then possible that the respiratory organs and skin are dry and poorly nourished because the mother organ has less blood and yin to send the son organ. If we find that both the mother and the son organs are deficient in yin, there is no block between them. The cause for both deficiencies is the deficiency in the mother organ. It is then possible to tonify the spleen yin and change to a diet that would improve spleen nutrition. And the increased energy from the mother would automatically flow to the son. So thank you po for your attention.
Thank you very much, Sir Dino. Next, we come to listening and olfaction. Not only should we listen to what the patient says, but also to how they say it. It is important to listen to the heart and breathing, take the blood pressure, the height, and the weight. In all the time we spend with the patient, we should be aware of their breathing, coughing, and other sounds, clearing their throat, sniffing, groaning. We find more about their imbalanced state from these clues rather than from all their verbal complaints. Now let's listen to the speech. Okay, fast and much or too much talking, it's heart-yang excess. Loud and aggressive speech means liver-yang excess. Slow, halting, shaky voice would indicate heart-chi deficiency. Rough or hoarse voice is heart-yin deficiency. Soft voice, liver-yang or chi deficiency. Stammering, heart-yin deficiency, yang excess or liver-yin deficiency. And slurring speech, heart-yang or chi deficiency. Now for the cough. Strong and urgent cough means lung-yang excess. Dry and urgent cough, lung-yin deficiency or yang excess. With a lot of mucus, lump dam stagnation, cough that is weak or soft, lung-yin deficiency, chi deficiency. Breathing, full noisy breathing means lung-yin excess, dam stagnation, dry squeaky sounds, obstructive breathing, yang excess, bronchospasm. In the Western world, bombarded with perfumes and cosmetic products, such as soap gels and body cream, it is very difficult to smell the actual patient. But sometimes patients complain that their urine is stinking or that they have had to change their socks or shoes several times in the day because of smelly feet. We can also smell such obviously dominant scents. Strong burnt smell means heat or yin is decreased, yang is increased, fire heat, especially in the axilla, concentrated sweat. Foul breath, stomach yang is increased. Smelly feet means kidney yin is decreased. Smelly urine, kidney yin is decreased, yang is increased. All secretions and emanations tend to get more concentrated and strong smelling if the yin is weak. Secretions become more watery and less smelly when their water content increases. There may be a special smell you would associate with the patient, which could give a clue towards his or her dominant organ system, not necessarily an imbalance or disease. For the heart, burnt smell like burnt flesh, spleen, sweet smell like cooking rice, liver, rancid smell like rotten fruit, lung, pungent smell, and kidney, which is fetid smell or putrid smell like rotting fish. Now let's go to palpation. It is important to palpate a pain area, be it in a joint, the abdomen, or just in the muscle or tendon. If there is extreme pain on palpation, this could indicate yin excess or yang excess. If pressure is actually comforting, this shows deficiency. It is important to palpate the abdomen if you intend to needle this region, looking for an enlarged liver and spleen, cysts or tumors, abdominal rigidity, which may indicate peritonitis, fecal matter in the intestines, or a superficial and strongly pulsating aortic artery. Extreme care must be taken to avoid this. Palpation of the back shoe points is a very useful method of diagnosis, and treating the positive reaction points among the back shoe points will help alleviate discomfort in the organs and improve their function. Supposing a patient comes with abdominal distension and diarrhea, he is not very clear about location of the discomfort. How does one decide if it is from the spleen, the small intestine, or the large intestine? If you palpate the back shoe points of all three organs for tenderness, you can find the culprit organ. Positive reaction points on back shoe points like nodules, tense muscle, etc., can show that these organs are chronically diseased. By needling these positive reaction points, one can actually see that the nodules or tension area becomes smaller and the organ improves. Okay, let's go to pulse diagnosis. This is a very old practical wisdom from TCM. In ancient China, it was very important to have a method of diagnosis which like this, which could diagnose imbalances in the body, both during and before illness actually manifested. Preventing illness had been very important in the past. If symptoms of disease appeared and worsened, there were no antibiotics and not much possibilities for surgery, and the patient had to be left to die. In the present day, things are quite different. The human body can be kept alive and functional using many artificial means. However, in this day and age, pulse diagnosis is still a very important part of diagnostic wisdom because it tells us about the state of blood, energy, and body fluid in the three body warmers and in the organs and tissues. Through this, we learn the tendencies of our body energies, even when the imbalances are not manifesting in symptoms, and correct them well in time. There are many ways to use pulse diagnosis, and one could make it as complicated as one wishes to. We use the pulse mainly to confirm diagnosis of the patient. Not only can you test if your diagnosis was correct, you could also check the pulse after treatment to check if your treatment has balanced the energy correctly, as the pulse should have changed. Okay, so let's take a look at this diagram. The therapist's fingers are at right angles to the patient's wrist. The middle finger is on the prominence of the styloid process of the radius. The index finger is between the wrist fold and the middle finger, and the ring finger is the same distance proximally to the middle finger. Thank you very much for your attention. Let's now listen to Sir Dino Pinheiro once again for Diagnosis Part 3. Good afternoon ulit, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Okay, we continue with lump diagnosis. Sa method of diagnosis, we observe, listen, smell, and touch. First, we take the history. Sabi ng author, I will start with history taking. As we listen to our patients' problems, it is also important to listen to the unspoken information. Listen to the tone of their voice, see the way they speak, observe their body language, and note the emotions behind the voice. In this interaction between the therapist and the patient, things are not always as they seem. In some difficult cases, it can take me about 5 sessions into the treatment to actually see the real problem of the patient. And by then, they have diagnosed me to be an incompetent doctor. Many a time, male patients come with excuse of backache as their problem, when their main problem is impotence. Patients come for treatment of hay fever and forgot to mention that they have ulcerative colitis and are on medication for this. Patients feel safe to give a physical complaint even though it appears always in the presence of an emotional state. Sa clinical example, we have chronic fatigue syndrome of a female 42 years old. A woman came, sabi ng author, to me recently with her diagnosis of chronic fatigue syndrome. She was an alternative medical practitioner and dislikes going to doctors. She said that she was always tired. Her tiredness was particularly worse before her periods. And she suffered from dysmenorrhea at the onset of the period. She had a clerical job for 2 days in a week, and on the other 3 days, she saw patients at her house. She was married with no children. Besides work, she went to the gym 2 to 3 times a week and worked out for 45 minutes or so. She felt better after the gym. She was apprehensive before seeing patients because this consumed all her energy. But she enjoyed her therapy work. She liked her other job because she could meet people. Sabi ng author, I was surprised at the amount of activity she packed in a day, considering she had no energy to do them. She had a distinct edgy, high-toned voice, which was not loud, but sounded as if someone placed their hand over her mouth as she was shouting. She was mostly rather pale, but would have a red face, especially after a gym workout. She always complained about the patient missing their appointment with her, friends not coming to assign dates, and how at work her team got praised when she had done all the work. She needed to vent these feelings, which seemed to have stayed with her a long time and sapped her energy. Sabi ng author, I asked her why she felt so strongly about everything and why she could not act on her feelings with people concerned. She came to the picture of liver yin and chi deficiency with a quick rising of yang, which made her quickly angry and lowered her tolerance. Though she could not directly confront those who angered her, she showed the anger on nonverbal ways. The physical exercise was a God-sent gift for her, as it allowed her to vent all this pent-up anger. She found it difficult to let out or eliminate emotions, and she had problems starting bleeding, hence the dysmenorrhea. I then treated her with points, liver 8, tonification point, UB18, back shoe of liver, LI4, the great eliminator, lung 1 and lung 9 to strengthen the lung yin, which in turn controls liver, gallbladder yang. Spleen 6 and spleen 8, symptomatic points for dysmenorrhea. Do 20 to help her detach from the situations that made her angry. And Ren 6 for energy. It took me 5 sessions to come to this conclusion because she always felt her problem was physical. What I had got in the first place was her diagnosis of herself, not her symptoms. This is a common problem with patients coming with a pre-made diagnosis, either theirs or others. So as you can see here, history taking is mainly to go through the motions of not missing something important. Our diagnosis session goes on beyond the first consultation. We have to keep our eyes and ears open all the time. Thank you for listening.
Thank you very much, Sir Dino. Okay, we will continue discussing the diseases of the earth element. We now go to lactation problems. The breasts are associated with the earth element on 2 counts. 1, because they are used to give nutrition to another human being, so that's very earth. And number 2, because the stomach meridian flows on the breasts. We can treat all breast-related problems on the stomach and spleen meridians. To increase lactation, if after the baby is born, the mother has no milk or not enough milk secretion, this is most probably due to spleen blood or nutritional deficiency. To improve this, It is first important to ensure that the mother is eating a nutritious diet, proteins, vegetables, fruits, and plenty of fluids. It is important for her to get enough sleep. Treatment. Liver 13, which is the front view of the spleen. Spleen 3, earth point, house element point, so it tonifies the yin. Liver 1, wood point, house point of the liver. Ren 12, the front view of the stomach, and stomach 43, the wood point of the stomach, which is the grandmother point, tonifies stomach yin. Now, let's talk about breast distension, problem with lactation. That's why some women cannot nurse. Sometimes, if the birth was assisted or the mother had a CS or cesarean section, it is possible that the milk does not flow easily. There is distension and pain in the breasts, but nothing comes out. Points to move and circulate qi and to improve elimination are used. There should be improvement within 1 to 2 days. 2 to 3 treatments can be performed in a day. Points to use are stomach 40, which is a luo point. It improves circulation of thick fluid. Spleen 9, the water point, increases elimination of fluid. Li4, great eliminator. GB37, the luo point, so it improves liver qi. Light plum blossom topping from the base of the breast towards the nipple, especially on the sides. Needle tender bakshu points behind the breast. The most common tender points are bladder 17 and bladder 20. Then apply dry cupping, 10 minutes. Breast pump can be used to start the flow of milk initially. Thank you very much for listening. Let us now listen to Ma'am Lynn Galarita of QC for Therapeutic Methods, Part 4. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. So we're on our fourth part of the therapeutic methods. Last time we discussed the first two methods, which are reinforcing and reducing. For today, we'll start the third method, which is warming. So what is warming used for? This to warm meridians and remove obstructions from them, warm and nourish yang qi, warm middle energizer to dispel cold, and restore yang from collapse. Warming is also used or applied for cold syndromes. If regular meridians become tight, moxibustion is applied. In case of coagulation, we give warmth and promote free flow of qi. Moxibustion is applied in case of cold in blood. To warm meridians and To remove cold from the meridians, we apply warmth. Acupuncture with needle retaining or moxibustion is applied to points along meridian affected by pathogenic cold. For warming middle energizer to dispel cold, we use CV12 and stomach 36 with needle retaining or moxibustion. So middle energizer refers to the stomach, the liver, the spleen, and the gallbladder. Okay. So among the important points for this method, one is CV12. It is the best point to moxa for cold deficient patterns of spleen and stomach. CV12 is the front view point of the stomach. So how do we locate this? On the anterior midline, fortune above the umbilicus. So from the umbilicus to the sternocostal angle, it is midway. So we needle this perpendicular 0.8 to 1.5 tune. We observe caution in needling this point, especially in thin patients where deep needling may penetrate the peritoneal cavity. Next point is stomach 36. Daily moxa on this point preserves and maintains health and extends life. So this is one of the very popular acupuncture points. So again, to locate these points below the knee, tune inferior to stomach 35, one finger breadth lateral to anterior crest of the tibia. Or we could locate GB34 first. The point lies one tune inferior and one finger breadth lateral to anterior crest of the tibia. Stomach 36 is just one hand breadth below stomach 35. We do perpendicular insertion on this point 1 to 1.5 tune. We use warming for restoring yang from collapse. So for this, we usually moxa CV4, CV8 to treat cold extremities due to decline of yang qi. Among yang collapse patterns is heart yang collapse. This condition could lead to a medical emergency, so we should be very vigilant when we see symptoms like palpitations, shortness of breath, weak and shallow breathing, profuse sweating, cold limbs, cyanosis of lips. Severe cases, there is coma. The tongue will be very pale or bluish purple and short. The pulse will be hidden, minute, and knotted. Key symptoms for this are cyanosis of lips, the hidden minute pulse, and cold limbs. So next point is CV4, or the gate of origin. This point is a powerful point to tonify qi and blood and strengthen body and mind. It is 3 tune inferior to the umbilicus on the anterior midline. Needling is done perpendicular, 0.5 to 1 tune, or an oblique insertion directed inferiorly, 1 to 1.5 tune. Caution should also be observed, as deep insertion may penetrate full bladder, which should therefore be emptied before treatment. Next point is CV8, or the spirit gateway. Needling on this point is contraindicated. Its main function is to strongly tonify the yang. We use indirect moxa after filling navel with salt. This point is located in the center of the umbilicus, or the belly button. As needling is contraindicated, we use only moxibustion here. So to do moxibustion, we use salt. We fill the navel with salt, or place a sliced ginger, crushed garlic, or an aconite cake on top of the belly button, and place moxa cones on top of the salt or the ginger and the garlic, and do moxibustion for 20 to 30 minutes. In general, warming cannot be used for heat syndromes. Thus, moxibustion should be carefully used for syndromes of yin deficiency. So this deficiency yin syndrome, in which yin is damaged and unable to restrict yang, and that yin fails to nourish and moisten the organism. Among the manifestations are feverish sensations in palms, soles, and chest, or the 5-palm heat, emaciation, flushed cheeks, dry mouth, dry throat, night sweat, tidal fever, red tongue with less coat, vacuous, dready, and rapid pulse, and heat syndrome. So this stops our discussion on warming. Please join us again for the next therapeutic method. Thank you for listening.
Thank you very much, Ma'am Lynn. We'll listen once again to Sardino Pinheiro for the controlling cycle, part 6.
Okay, we continue with lump basics, controlling cycle, part 6. We have an example of a controlling cycle, eczema, which is a thin, dry skin with red, inflamed, and itchy lesions. The lung is a yin organ, and its yin is over-controlled by the yang. This yang could be coming from excess yang in the fire element. Often, patients with neurodermatitis are restless, may have a high-pitched voice, and talk very fast. They can have problems going to sleep and can have pruritus in bed. This is a heart-yang pattern. As the fire element generates interior heat and sends the excess heat to over-control the lung yin, we need to sedate small intestine 8 and triple wormer 10 in order to bring down the heart-yang. We also must balance the lung by tonifying its yin and sedating the yang. It is quite possible that a patient with eczema can have this skin type. Okay, we have here okay, so we have here the illustration of how the fire element controls the metal. Okay, not have any problems with the fire element. If this the case, then it would suffice to balance the lung alone. An excess of yin in a yin organ or yang in a yang organ can flow in 3 ways. First, to its coupled organ, this is of the opposite polarity. Number 2, to its son organ, this is of the same polarity. And number 3, to its grandson organ, also of the opposite polarity. Where it will flow depends more on where there is the greater deficiency. It would stop flowing when all these organs have filled their yin to an equal level. Generally, an excess in an organ seems to affect its coupled organ and the organ it controls in a similar way. Normally, the points taken into consideration in this equation would be lung 7, the Lu connecting point, and sedation of the large intestine 4, the U1 source point. However, in this case, there is an exception. Eczema and allergic asthma are interior-exterior manifestation of the same organ system. The pathogenic factor is in the exterior during skin disease and could move inwards during asthma. A Lu connecting point of a yin organ moves the energy from the outside, which is yang, to the inside, which is yin. If the patient has eczema but no asthma, then a Lu connecting of a yin organ should not be used. It may cure the skin problem, but the patient could not get asthma. Could now get asthma, I mean. In this case now, the lung 8 own element point can be used to tonify yin and Li2 sedation for sedating the yang. So here, the points to tonify the yang of yin organs. We use lung 10, the fire point, small intestine and triple wormer, the kidney 3, the earth point for the stomach, and Li4, the metal point for large intestine, heart 3, the water point for urinary bladder, pericardium 3, the water point for the urinary bladder, and spleen 1, the wood point for gallbladder. For points to tonify the yin of yang organ, we use Li5, the fire point for heart and pericardium, UP40, the earth point for the spleen, GB44, the metal point for the lung, small intestine 2, the water point for the kidney, triple wormer 2, the water point for the kidney, and stomach 43, the wood point for the liver. The main difference in energy flow between the mother-son cycle and controlling cycle are that while in the mother's sun cycle, energy flows from yin to yin organ and yang to yang organ. In the controlling cycle, energy flows from yin to yang organ and yang to yin organ. What is similar is that in both cycles, the energy that flows out of a meridian retains its polarity. Thank you for your attention.
Thank you very much, Sir Dino. Let's now listen once again to Ma'am Lynn Galarita of QC for meridian theory.
Good afternoon ulit. So from the triple warmer meridian of the hand lesser yang last time, we now go to the gallbladder meridian of the foot lesser yang. The gallbladder meridian of foot xiaoyang or foot lesser yang begins near the end point of the triple warmer meridian at the lateral corner of the eye. It follows a zigzag path over the temporal and parietal area of the head and goes through the occiput to the sides of the shoulders along the trapezius muscle. It flows then to the side of the thorax and makes a zigzag across the ribs. Then on the flank and the hip, it continues down the side of the thigh and leg, finishing on the lateral side of the fourth toe. Its inner branches. The branch behind the ear enters the ear and flows to the front to enter the eye. The branch from the outer canthus runs on the cheek, meeting stomach 5 and stomach 6. This branch enters the thorax to connect with the liver and enters the gallbladder. From there, it flows to the lateral side of lower abdomen near the femoral artery at the inguinal region. The branch at the dorsum of foot splits off at point GB41 and flows to the big toe to connect with the next meridian, which is the liver. So let's start exploring the important points of the gallbladder meridian. First up is GB1. It is located in a bony depression on the lateral aspect of the orbital margin on the level of the outer canthus of the eye. This is the first point and the entry point of the meridian. It should be needled with skin pinch at needle tip towards the outer canthus. It is used against ptosis or drooping of eyelids, in facial paralysis where eyelids do not close well. Next point is GB8. It is 1.5 zoom directly superior to the apex of the ear in a depression on the upper border of the temporalis muscle. This is a symptomatic point for tinnitus and ear-related dizziness. This point is needled subcutaneously for a distance of 1 to 2 centimeters above the ear and twirled small and rapidly for about a minute. The needle is then left in place for 20 minutes. It coincides with the vertigo auditory area of scalp acupuncture, and this may explain why it works in these conditions. Next point is GB12. It is located in a depression directly posterior and inferior to the mastoid process. So it's below the mastoid process in close point to GB20. This is also a good point like GB20 for improving the sight. Next point is GB14. It is located with the patient looking straight ahead on the pupil line, approximately 1 zoom superior to the midpoint of the eyebrow at the junction of the frontal eminence of the superciliary arch. This is an excellent point for treating frontal headache and problems with eyes. It is also effective in correcting drooping eyelids, dry eyes, and due to eye stress. needled intramuscularly with needle facing the center of the eyebrow. It assists the eyebrow raising movement, and therefore it is used in facial paralysis. Next point is GB20. It is located at the lower border of the occipital bone in the depression between the origins of the sternocleidomastoid and trapezius muscles. It is easily the most important point in the head. It is a wind eliminating point for head and face, meaning all allergic symptoms, irritation of sensory organs, and headaches will clear with this point. It is a point that makes the senses clear, and it is good for treating symptoms such as blurred vision, tinnitus, loss of smell or deafness, short or long sight, loss of taste, etc. It helps one to think clearly and see situations clearly. Thus, it is good for making decisions. This caps our discussion for now. Please join us again tomorrow for our continuation on the Gallbladder Meridian. Thank you for listening.
Thank you very much, Ma'am Lynn. We now come to the last topic for today. We are actually starting a new topic. It's called the chronic fatigue syndrome. Firstly, we will discuss the Western medicine concept of CFS. CFS is a relatively new disease. It is not clear what the causative agent might be. In Western medicine, there is no general agreement that it is a separate disease at all. Myalgic encephalomyelitis, or ME, in some countries called CFS, is an acquired disease that involves all systems of the body, predominantly in the nervous, immune, and endocrine systems. In the WHO International Classification of Diseases, CFS is classed as a neurological disease. Myalgic encephalomyelitis, or chronic fatigue syndrome, affects all age groups, including children, and all racial or ethnic and socioeconomic groups. It tends to reach its peak in a time span between 6 months and 6 years. The reason that there is no general agreement on the nature and causative agent of this disease is that there is no conclusive test specific to CFS. There is no blood test that would conclusively prove a patient suffers from CFS. ME or CFS starts as an influenza-like illness or an infection of the upper respiratory tract. Instead of remission of the influenza or of the respiratory infection, a group of other symptoms gradually appear. Various studies have confirmed that there is often an interruption in one of the mechanisms of the immune defense system. Current research shows that CFS might be caused by a viral infection. Recent studies have suggested the possible interaction between some classes of virus, herpes virus, enterovirus, parvovirus B19, retrovirus, and Ross River virus, or RRV, and the development of the syndrome. Herpes viruses are characterized by the fact that they provoke infections, which, after the termination of the clinical phase, consequent to the primary infection, remain in a latent state in some cells, occasionally reactivating, sometimes with full-blown and serious clinical manifestations triggered by different stimuli, generally in conjunction with a diminution of the cell-mediated immune response. The herpes viridae family is divided into 3 subfamilies, depending on their site of latency. Alpha herpes viridae, or the herpes simplex virus, HHV1 and HHV2, varicella zoster virus, HHV3, site of latency, nerve endings of the CNS. Beta herpes viridae, the cytomegalovirus, HHV5, roseolovirus, HHV6, and HHV7, site of latency, endothelium and epithelium of salivary glands and renal tubules. Gamma herpes viridae, Epstein-Barr virus, HHV4 and HHV8, site of latency, lymphoid cells. Enteroviruses are members of the family Picornaviridae and consist of about 72 serotypes, including Coxsackie A and B viruses, echoviruses, and the poliovirus. This group of viruses has been associated with upper respiratory tract infections, aseptic meningitis, and paralytic poliomyelitis. The Coxsackie enteroviruses are thought by some to be responsible for the pathology of CFS. Enteroviruses enter via the mouth, causing sore throat and enlarged glands. Immune response can be compromised by physical or mental stress. So bawal ma-stress. Immunosuppressive drugs, pregnancy, malnutrition, or surgery. We shall continue with this discussion of the Western concept of CFS, or chronic fatigue syndrome, tomorrow. Thank you everyone for joining us, and we hope you can join us again next time. Thank you.